Hello, my name is Julie Twitchell. I'm the Outreach and Communications Manager with the Alameda County Healthy Homes Department. We work with a lot of low-income families who are seriously impacted by the cuts happening to CalFresh and CalWorks. In this area with already expensive housing, what it means is when families don't have the support they need for food, they end up having even less money to spend on their housing. This results in families having to move into housing that is not in good condition, with a lot of families, doubling up in terms of housing. And the health problem with this is that a lot of these lower cost housing units on the market also have hazards that come with them. So we have families that are being susceptible to lead poisoning, asthma triggers, and safety hazards in the home because they can't really afford good housing. Now, this substandard housing shouldn't be that way in the first place. If they're paying rent, the housing should be in good condition. But unfortunately, in this area, we have a lot of poor housing, and we're working desperately to try to upgrade our housing stock and have more affordable and safe housing for our families. If you'd like to know more about this issue, you can visit our website at achhd.org. That's the Alameda County Healthy Homes Department. Thank you.
I'm Sheila Gunn Cushman. I'm 42 years old. I'm totally blind. I have other disabilities. I live with two people who are also totally blind and have other disabilities. Take a deep breath. I'm on IHSS, SSI, SSP, SSDI, Medicare, Medi-Cal, and I am on a Section 8 voucher from somebody else. And most of those programs have been cut in the last 4 years, and we've been fighting tooth and nail every stitch, every step of the way. I live in a world which seems to be unwelcoming to anybody who is different. People take for granted that everyone will walk, talk, think, see, hear, and we don't. But I'm very capable. I am an advocate. I work with Pushing Limits Radio. I design my own jewelry. I've had a business for 7 years, though I don't currently. I could be good in a job, except people are afraid of disability, and they think we can't do anything because of their own beliefs and stigmas about disability, so here I am. Very capable, very unemployed, and very, very frustrated. So what can you do about it? Well, start thinking about people who aren't driving, so like help transportation. Start thinking that people on programs like SSI, SSDI, TANF, all these good things that are supposed to help people out when they're down can actually get up, don't just throw us out with the garbage. And do things to make the laws already in place to make things accessible to everybody stick. Like make all these agencies who do licensing and everything do their stuff in accessible format. You know they don't, even though the law's been around for 25 plus years. What's it gonna take, guys?
Go. Yes, I'm speaking out for myself as well as other seniors and disabled and homeless people. You know, we're sleeping in doorways and what have you. The biggest majority of the time you get evicted from the door, from outside, and everything we own, it means nothing. They just take it and trash it, throw all our carts and all into the dumpster. I've lost my medications, numerous of times from doing this. They give you a chance to get what you can carry, which is not too much, and everything we own is gone. And we're just actually, don't cut the things that's going to help the people that need it. You got many seniors, and they're good people. Just need somebody to care. Some of these vacant lots, warehouses, they can fix it for the homeless people. Seniors out there sick, they're dying, out there. It's just sad. You're supposed to be United States, supposed to care. I'm a disabled vet, and I'm out there. I've served my country, But it seems like it don't amount to nothing. They don't care. Care about us like we care. Thank you.
Hi, good evening. My name is Bill Collins. My age is 64 and a half. I'm For St. Mary's, I'm an advocate for seniors, and I'm on Social Security. And my observation of what I've seen in the social cuts is that it's very important for us to have our social abilities. For example, for me, I look at life starts with a child, and you want to give a foundation for a child in order to become a senior in well-being. If you take away from the children, you take away from the seniors. Every building that I've come downtown is well fortified to last maybe 100, 200 years. Take that experience that you would put into a building and put it into humans, and you'll have a foundation. A building won't stay without a foundation. And that's something that we neglected in life, in my learning. Childhood is the beginning of a foundation. Seniors are the end of a foundation that should have been built in childhood and on up through the working area. And I'm seeing that has been neglected. You live to die, and that's not a place to go. It happens. And that's how I feel about the social networks.
Hello, my name is Jean Tony. About 2 years ago, there was a fire in my apartment, and so it was an electrical fire, and I was lucky to happen just to wake up at 2 o'clock and get out and get the neighbors up. But since that time, I've been fortunate in that I've had relatives or friends that stepped out to help me bridge the gap between losing an apartment and homelessness. And but during that time, I began to see and to observe people around me that I had turned away from before. And then I began to notice them. And then working at St. Mary's, I had an experience when a man came in who was ill, and we called an ambulance for him, and I said, is there anything I can do for you right now? And he said, yes, watch my cart so that when I get out, I'll have some place to come back to. And that really touched my heart. And so we watched his cart, we got him his medication and his glasses, because this was where he put his personal belongings. And his cart was where he belonged, that was his home. So wherever he was, the cart was. And when separated from his cart, he felt lost. He had no place to go, or nothing to hold on to, nothing that he could say, but this belongs to me and I belong to it. I noticed talking with children how programs have been cut out of their schools and how most of them had gone to school hungry. And when you leave a house hungry, you're not going to go to school and learn and stay within your role and have correct behavior. So it is when cuts are made, it not only affects those that you cut, but it affects the whole environment, the whole neighborhood, the whole society. And we cannot run up the hill and hide from hunger, disease, and crime. Now, if that is what you want to create, let us know, and we will not support you with it. But we're asking you to support a society that is healthy, that is happy, that is safe and thriving, and you have it within your power to do so. So look at the cuts that you're making, look who you harm, and look at the ripple effect. It's not just one person, it's the whole society. Thank you.
Hi, I am a parent leader with Parent Voices. My name is Afaru Lynch. I'm a mother of 2 children, Janie, who is 5, Anna, who is 3. I work in the hospitality industry, working weekends, nights, most holidays. I cannot afford childcare for my children. I need safe, affordable childcare for my children, and I've been on the waiting list for 4 years with Bananas since my youngest was born, almost 4 years. The human impact is just being able to survive without losing your mind. Waking up every day, getting my kids ready, turning around, having to go to work, getting off at 10 o'clock, no time to prepare, It's a constant struggle, and I need help. I'm waiting for help. I just feel like working so hard, you want more for your children. You think you're supposed to have more for, your family. You should have products of your hard work. And right now I have no product of my hard work other than my beautiful children who I do everything for. So I just feel like we need more help in the county, on the county level, on the city level. We need to push, Governor Brown, Jean Quan, to invest in early childhood education. So my children do not have to go to a babysitter. They can go to a place where they're learning and being productive and, being cared for and loved, most of all. That's what I want.
My name is Janie Castillo. I work at St. Mary's Center, which is a homeless service provider in Alameda County. We work with extremely low-income seniors and also folks who are living on the streets in Oakland. I'm also a resident commissioner of the Oakland Housing Authority, and I'm also a homeowner in the city of Oakland. And I have 4 children who are all doing really well right now. But 21 years ago, that wasn't the case. I depended on CalWorks and a Section 8 voucher to help us survive. And without those services and the nonprofits that supported me through really long years from moving from homelessness into my own place, I could not have done it. So these services are so critical. The Cal Fresh program supports families so that they could make ends meet. As far as food is concerned, our GA program supports individuals so that they could make it. All of these programs sustain life and improve the quality of life, not just for the people that receive these benefits, but our whole community. Because if our whole community does better, then we all do better. Thank you so much, Supervisor Chan, for bringing awareness through the Human Impact Budget campaign. We love you for that. We need you to continue the hard work. And we're asking everyone to step up and support this campaign to share our stories to community members.
Hello, my name is Dee Madnick, and I'm from the Senior Support Program of the Tri-Valley. We are located in Pleasanton, and we serve low-income seniors in Pleasanton, Livermore, and Dublin. What we're finding in our agency is that there is a bit of a forgotten population on the east end of the county, specifically in regards to IHSS workers. We do not have a very good resource of workers available to help our low-income seniors in the area. Consequently, they're given lists from Oakland of people living in Oakland that don't want to drive. The cost of gas, having a reliable car, and the time in traffic are all factors that affect the seniors in our area. The other areas of impact we're finding is there's not enough affordable housing. The lists are long, they take years for people to get in, and in the meantime, they're struggling and suffering with trying to find housing. When adults reach age 65 and retire, especially for women, they are almost always thrust into a low-income, poverty-level lifestyle. We at Senior Support Program try to maintain dignity, respect, and provide services and assistance for them, but we are up against a huge wall of resistance in availability and resources. Recently, with the Affordable Care Act coming into place, we have found it harder to get in touch with Medi-Cal workers for issues that are already in existence. We've even found Medi-Cal workers that don't understand share of cost and have misinformed applicants on the correct benefit availability. So I'm asking for additional resources. There is a facility in Livermore on Pacific Avenue that does some Medi-Cal service work, but I'm asking for more Medi-Cal workers in that local area that we can access and bring our seniors to personally speak to someone. We're finding they're constantly hiding behind their phone systems, their voicemail, and their supervisors, and we're not getting any service. That, and one more thing, is the reduction of food stamp or California Fresh. These seniors are relying on this for their food to supplement their low Social Security, or if they're on SSI, they cannot do without the Cal Fresh program. That being said, I want to thank you for listening, and I appreciate you allowing me to speak. Thank you.